Okay, I'm with Tammy here at Erickson Krehbiel Dental Group in Des Moines. And Tammy has a unique position in the practice. She is designated as the Invisalign Specialist. And so, Tammy, I just want to get a little bit of a job description on kind of what being an Invisalign Specialist here in the practice entails.
Okay, one of the things with Invisalign Specialist is that I'm always just on hands, ready to have access, give the patients information in regards to Invisalign, any questions they might have about their treatment plan, how Invisalign works, just some general inquiries that they might have, as well as going into more detail with them about how Invisalign works with their 3D technology versus traditional braces. And then of course the bottom line is the patient wanting to know the pricing, what their insurance might cover, and what their out-of-pocket will be.
Okay, so you work pretty well hand in hand with the hygiene team as they go about their daily activities, and you know the doctor obviously comes in for the exam, and then the hygienist presents the patient over to you to continue that dialogue on Invisalign. Is that correct?
Yeah, definitely. We have a system in place now that works really well, where the hygienist and the doctor do their transfer that way with the patient in discussion in regards to Invisalign, and then they pass them off to me. What's great is they kind of give me a heads up through our messenger system, through our computer, so I can do a little legwork prior to the patient being done. So I can have all the pricing ready. I have a folder that's ready for them that has some frequently asked questions, some literature, all the things that they would need to take home with them at the end of their dental appointment.
Okay, great. And then you also do some of the follow-up, you know, the phone calls and just trying to re-engage the patient in terms of their interest level.
Right, exactly. I definitely get a feel from the patient. I kind of ask them at the end, what are your initial thoughts? Just so I can get some feedback from them to see, if there is that interest level, or if it's something that just no, it ends right there. If I do get a good feeling from them and it's something they're interested in, or something they've never really thought about before, I will give them a follow-up phone call, and I say to them, I'd love to follow up with you in whatever that time frame might be. It might be 2 days, it might be 2 weeks, whatever works out for the patient and I.
Now, you guys are also very active in different promotions, and so tell me a little bit about your role in, the coordination of certain promotions and the Invisalign days and things to that effect.
Okay, something new that we've done. I started here just over a year ago, really have kicked off Invisalign. It was something that the doctors had done, but I really just took it under my wings and have tried to incorporate it into all of our daily hygiene visits. And then we've incorporated doing some Invisalign days. So right now we're doing 2 a year. We started last fall with an Invisalign day, and then we've done one now today. Today is our second Invisalign day, both which have been very successful. Marketed through keeping track of our in-house patients that have had an Invisalign consult with me. And I follow up that way through mailing a flyer and a cover letter to them and a follow-up phone call.
Okay, great. So you mentioned you started just a little over a year ago. Tell me about the upswing of your Invisalign production since coming on board and being the Invisalign specialist here in the practice.
Okay, that's one of the things that I love here, is that it's something that I can kind of say is my baby that I've done here. So when I started in early 2011, we just had a few patients that have been doing Invisalign. So one of the successes as a practice, as a team, that we've really undertaken is that in 2010 we did 10 cases that year, and then last year in 2011 we did 45 cases, which the majority of those were the last 6 months of our year. I kind of got a feel for how the practice was running. We also got all the hygienists on board, getting them trained, and getting a whole flow as a business on how we wanted to run things. So we've really seen an upswing since about the middle of last year.
And so second half of last year, you did earn the moniker of Invisalign Premier Provider. Tell me about where we are tracking this year.
Well, we are right on track with that. The great news is we're only, 3 months into the year and a week, so just the first week of the second quarter. And I can say that we are already, for 2012, we're sitting at around 27 Invisalign. So we're well on our way to increase our numbers from last year.
Well, that's fantastic. Now, not to misunderstand, Invisalign isn't all you do here in the office. So just tell me, in the times when you don't have an Invisalign consult to sit down with, I mean, you do have other responsibilities too.
Yeah, definitely. Anything that we do, we're just a team of 3 that work up here in the front office. I do anything from answering the phones, so backup for phones. I do a lot of eligibility for patients, checking on insurance just for our everyday dental appointment patients. That's my main focus, and then the Invisalign Specialist, which is really what I love.
Well, and I think anytime if there is an Invisalign discussion to be had, you're allowed to pretty much stop what you're doing and direct your attention towards that effort, correct?
Right. It's really nice too in this practice. We have where we are now is just a private consult room, so I can just stop because we have the 2 other gals here up front. I stop what I'm doing, get my folder and my information ready for that patient, prepare myself into this consult room, so we have a private area that I can discuss their questions and things like that with them.
Well, I got to compliment you and keep up the great work.
Thank you.